Hello and welcome to the Smiling Signs Auslan resource. The topic of this video is dental fillings. Click on the timestamp in the description below to be taken to the relevant topic you would like to learn about. Don't forget to like this video and subscribe to learn more about oral health. In the last video titled Tooth Decay and Preventive Treatment, we covered the different types and parts of the teeth, tooth decay, and ways to prevent tooth decay. Tooth decay can be prevented. That's why it's important to keep good care of your teeth at home. Brush twice a day with a fluoride toothpaste. Clean between your teeth every day and eat a low sugar diet. Your dentist can help to prevent tooth decay. They may apply fluoride to your teeth to help protect them. If your dentist finds tooth decay, they will tell you the best way to treat it. Most tooth decay can be fixed with a filling. This video will talk about fillings. You can learn more about different treatments in other Smiling Signs videos. Fillings are used to fix a tooth after it's broken or damaged by tooth decay. Tooth decay is removed from the tooth. The empty space is then filled with a dental filling material. Your dentist may use a local anesthetic needle to make the tooth numb before they do the filling. There are different types of filling materials the dentist can use to fix teeth. There are advantages and disadvantages to each filling material. Your dentist will talk to you about what is best for each tooth. To choose the best material, your dentist will look at a few different factors. They will consider how big the filling needs to be and where the tooth to be filled is in the mouth. Your dentist may look at how much they can see of the tooth when you smile, or if the tooth does a lot of work when you bite and chew. There are two main types of filling materials, amalgam fillings and tooth-colored fillings. There are two main types of tooth-colored fillings. One is called glass ionomer cement, or GIC, and the other is composite resin. Amalgam is a silver-colored filling material. Some people call it a metal filling. It is used to fix premolar and molar teeth. Amalgam fillings can last a very long time, but over time can get darker in color. Ingredients in the filling material include mercury, silver, zinc, and tin. Amalgam has been used in dentistry for over 150 years and has been well researched by dentists and scientists. Some people worry that the mercury in dental amalgam can cause health problems. Scientists have not found research to show that this is true. Small amounts of amalgam do get absorbed into the bloodstream. However, the kidneys flush this mercury out of the body in urine. Amalgam can cause allergic reactions in some people. This may cause redness and itchiness in the gums near the filling, but this is very rare. Dental amalgam is not used often anymore. This is less to do with harming the body, but rather its effect on the environment. Amalgam from dental clinics needs to be thrown away carefully to protect the environment. Dentists have special equipment to stop extra amalgam from being flushed down the drain. So, if you already have amalgam fillings, should you get them changed for a tooth-coloured filling? Amalgam is a safe and long-lasting filling material. There is no scientific evidence that supports taking out healthy amalgam fillings and replacing them with tooth-coloured fillings to improve your health. If you want to change your amalgam filling for a tooth-coloured filling, it's important that you know the risks. Dental amalgam is not used very often anymore, but your dentist may choose it for some fillings. Some of the risks involved in replacing a healthy amalgam filling include each time a filling is cut out of a tooth, more healthy tooth structure is removed. This can cause the tooth to become weaker. There is no guarantee that the new filling will be any better than your amalgam filling. All dentists are trained in removing amalgam fillings from teeth. The first tooth-coloured material we will discuss is composite resin. Composite resin is glued to the tooth using a special type of dental adhesive. When a filling material is glued to the tooth, less healthy tooth needs to be cut away. This means a smaller filling can be used to fix the tooth. Teeth with more healthy tooth structure are stronger. Composite resin comes in many shades and colours. This lets the dentist match the filling colour to your tooth. Glass ionomer cement, or GIC, is another common tooth-coloured filling material. Fluoride is a key ingredient in this filling material. The fluoride can help to make the tooth around the filling stronger. GIC is not as strong as composite resin. It is commonly used for temporary fillings and fissure sealants, among other things. Fissure sealants are discussed in another video. Fillings can last a long time, but they will not last forever. Studies have shown that amalgam and composite resin fillings last very well. One research study reported that these fillings last an average of 11.7 years. Other research studies showed that after 10 to 12 years, over 80% of the amalgam and composite resin fillings were still in good condition. The length of time that a filling will last depends on many factors. It's important to care for your fillings, just like your natural teeth. Fillings can last longer when they are looked after well. Fillings sometimes need to be changed. The filling material may be replaced with the same material, or sometimes a different material may be used. Some reasons the filling may need to be replaced include some of the following: chipped or broken fillings, the tooth breaking around the filling, pain, The shape of the filling causes food to get stuck, changes in the filling color over time, which is now easily seen when smiling, or decay underneath the filling. We will now run through the usual steps in getting a filling. If you would like to skip this section, pause this video now and move to the next section using the timestamps in the comments below. These are the general steps for a filling, but all dentists work differently. The first thing your dentist will generally do is give a local anesthetic needle in the gums. This makes the tooth numb so that you will not feel any pain during the filling. For very small fillings, this may not be needed. A rubber dam sheet may be put around the tooth that's getting the filling. This sheet keeps saliva away and keeps the tooth dry to help the dentist fix the tooth as best as possible. The tooth decay is then cut out of the tooth. This makes a hole in the tooth, which is then filled with filling material. The last step is to polish the filling. The filling is polished to make it smooth for your tongue to touch and comfortable when you bite together. After a filling, the teeth and mouth will still be numb if local anesthetic is used. It is important to be very careful to not bite your cheek or tongue when they are still numb. Until the numb feeling has worn off, only eat cold and soft food and drinks, and be careful to not bite your cheek or tongue when chewing. New fillings might make the tooth sensitive. This may go away after a few days, but it can continue for up to 2 weeks. If your tooth keeps being sensitive or gets worse and turns into pain, make sure you contact your dentist. The purpose of fillings include that they can take away pain, stop the tooth decay from getting worse, and prevent dental infections. Fillings can make the teeth look better and help you to chew, speak, and smile comfortably. Fillings do not last forever. They can break, chip, crack, or change colour. Teeth with very large fillings may develop pain or infection. New fillings may sometimes make the tooth sensitive. Some filling materials may cause allergic reactions, but this is rare. Sometimes people can feel dizzy or sick after the local anesthetic needle. If you have any problems during or after your filling, tell your dentist as soon as possible so they can help.